Hello and welcome to the third of our Growing Care Farming monthly themed webinars. This particular webinar covers reducing COVID-19 risks and reopening your care farm. So we hope you enjoy it and find it useful. Just some brief housekeeping points before we start. This webinar is being recorded and it will be uploaded to the Social Farms and Gardens website in due course. So you can go back and revisit anything that you feel that you've missed. Your details and attendance are private and we won't be sharing them with anybody else. Your attendance, the attendees on this are not visible via the video link. You can only see the presenters and you are automatically muted. So you can only hear the presenters, we can't hear you. If you want to ask any questions, they can be asked through the questions function in the menu to your right-hand side. You should be able to see a drop-down grayed out box with questions. You can type your question in there and one of the team will pick it up and ask it on your behalf. Or if you wish at the end, we can unmute you once the recording's finished to ask the question at the end. So feel free to ask any questions as we're going along. And any links in the presentation will also be pasted into the chat function, which is slightly different from the question function. If again, you look to the right-hand side in that box, you'll find a chat function. So any links we refer to, we'll paste them in there. So you'll be able to click on those links and view the information during this webinar. So at the moment, you should be able to see 5 faces on your screens. I'm Deborah Evans. I'm the Regional Care Farming Manager for Growing Care Farming. I'd also like to introduce Noelle Wilson. Give us a wave, Noelle. Yep.
Hello.
She'll be taking us through the first half of the webinar. Noelle has spent 17 years running a care farm before retiring a couple of years ago, and she was also a board member of Care Farming UK and instrumental in developing the Care Farming Code of Practice, and she's also one of our code assessors. We've also got Keely Elvin. Give us a wave, Keely.
Hi.
She is the Care Farm Manager of Elm Tree Farm in Bristol, and she's also a Code of Practice assessor. So both she and Noelle are very well placed to be leading on the webinar today. At the moment, you can also see Sarah Marison. Give us a wave, Sarah. She
Hi.
is Regional Support Officer for Growing Care Farming. She'll be monitoring the questions during the webinar and she will also lead on the question and answer session at the end. So please feel free to post any questions as they occur to you during the webinar, and then we'll pick them up with Noelle and Keely when they finish the presentations. There's an option in that question function to be able to post them either publicly or privately. And last but not least, we have Pearl Cousins. Give us a wave, Pearl.
Hello.
She's our Code of Practice Administrator and she'll be on hand to answer any code application related questions that come up, but she's also going to be posting the links that appear in the presentation into the chat function that you should be able to see to the right of the screen. When the presentation starts, Pearl and Sarah are going to turn their cameras off so as not to distract. We'll see them again at the end, so you'll just be seeing me, Keely and Noelle. So I'd now like to hand over to Noelle. She's going to introduce the checklist that we've developed to support reopening and to go through some of the issues that you need to consider.
Thank you very much, Debbie. Yes, so really, why have we created this checklist? Well, at Growing Care Farming, we've really received quite a number of queries from quite worried people wanting to know whether they can open and how to open. Most of these issues go right through Britain, but of course there will be some differences between England and the rest of the country. So what we're going to talk about today is really to do with England, and there will be links to help you if you're in Scotland, Wales or Ireland. Thanks, Debbie. Thank you, Debbie. Okay, what are we going to cover today? Well, first of all, importantly, can I actually open? Can I legally open? So really, this is at a couple of levels. Obviously, you need to check government guidance. but also really important that you talk to your referral agencies, talk to your commissioners, and just ascertain that you are okay to open before doing a lot of preparation. Secondly, we're going to examine whether our site is safe and whether you've prepared properly. So this is things like marking off areas where there are pinch points, looking at whether you've got the correct PPE and so on. Thirdly, we need to look at the people coming back. So this is staff, service users, carers and volunteers. Everybody needs to be secure that they are A, happy to return, and B, that they're not vulnerable and therefore perhaps excluded at this stage. Fourthly, you need to have a bit of an action plan, contingency plan, in case anybody develops symptoms and needs attention and getting home and so on. And then Keely will deal with how you actually deal with people once they're back on your site. Thanks, Debbie. Okay, so your checklist should take into account, firstly, government guidance. And it's quite difficult actually to find guidance that really is particularly relevant to care farms. And we will talk about where some of the other guidance can come from. The guidance for primary schools is quite relevant. And also a lot of local authorities will have specific guidelines for day centres, and they're probably closest if you've got adults with learning disabilities. But we can't create a checklist that covers every situation in every type of green care. So although we can help you today, it will be up to you as a manager of a care farm to look at this checklist and then develop it around your own particular needs. Thanks, Debbie. Next slide, Debbie, please. Okay, there really isn't a hard and fast answer about whether you can check. As I've just said, it's really difficult to find particularly relevant guidelines. Speaking from experience in Worcestershire, my own home county, you must contact the local authority before you plan to open. They will not let you open unless you've liaised with them. Now you need to develop a risk assessment. As you know, you don't have to actually write this down if you've got less than 5 employees, but I think you'd be very ill-advised not to write it down in our settings as care farmers. Thanks, Debbie. So, Health and Safety Executive advises that you must identify what work activities and situations might cause transmission of the virus. So Keely will deal with the particular activities. You've got to think about who would be at risk, and you need to determine how likely it is that somebody would be exposed. So you probably all use different risk assessments, but this, the one that we're going to see in a minute, actually, if we go on to the next slide, Debbie. So on the left, you can see that the level of risk in an unmitigated setting is at a level of 20, and this gives a score of very high risk. So obviously you must take a great deal of mitigation to bring it down. On the left, you can see that the level is a score 8, which brings it down into the medium risk category. As I say, you'll all have a big variety of risk assessments, but you must revisit all your risk assessments for activities and develop a new one specifically for your site for COVID. Thanks, Debbie. So, is my site safe and prepared? Well, if your buildings have been closed for a while, you would probably do a health and safety check anyway before you have people back on. Guidance on this you can find in the link there. So you might consider doing a deep clean. Now, technically, a deep clean is a matter of having all your fixtures out, cleaning all your windows, inside window frames, door frames, possibly steam cleaning floors and so on. I'm not sure how much of that is actually relevant for COVID as regards moving things out, but you would certainly need to do a very thorough clean and disinfect of any areas and any surfaces that people are going to come in contact with. Hand washing facilities. You might feel that you need to provide more. So there are ways round this. You can buy 25 and 50 litre cans with a tap on the bottom, and you could actually position those around your site. And if you are perhaps going off site or around the farm, you could put one of these in the back and people could use it on site instead of having to get back in a minibus or a Land Rover or whatever and come back to the main site. Toilet facilities, often on care farms, we have the bare minimum really of numbers. Portaloos might be a consideration, but they're about £100 a week, so obviously there's quite a big financial constraint there. Hand sanitizer, do you have enough stock? I can imagine that when your participants come back, you're going to get through an awful lot of hand sanitizer, but at least it is pretty freely available now, so go out and buy lots, I think. Your resources. You need to notice where pinch points are, and it comes to my mind around a tool shed where normally people sort of cluster outside and probably 3 or 4 people at once in the shed. It might be that you need to just have one member of staff dishing out tools. You have a one-way system, so people come in, collect tools and go out by a different route. And then you need to think about how you're going to disinfect your tools, and maybe Keely will pick up on this later, because corona can, I think, can live on softish wood surfaces for 4 to 5 days. So that means if you use your tools on a Monday, it's going to be next Monday really before they're safe to use. So maybe you have a wash and disinfectant site by your tools. Thanks, Debbie. Ventilation. Well, normally we're pretty blessed with ventilation generally on care farms, but it might be that you work at a barn, you work in a workshop, so check that all your windows do actually open, and that all your doors can be opened and propped open. And then we have other things that you'll have seen obviously in shops and so on, like taping off areas, marking out 2-metre zones in areas perhaps like rest areas and so on. And again, one-way systems if possible. Now you need to communicate all this planning, and you need to communicate with staff, with participants, and with commissioners before you actually open up. I think Keely's going to talk about some posters that she's developed that have got key messages about hand hygiene, social distancing, catch it, bin it, kill it, and so on. And the posters must be displayed for you to comply with government guidance on COVID-19. Tell service users and staff before they come back all the things that you're going to do. Tell them what safety measures you've implemented, and let them know what you expect from them as staff or visitors. And if you can, have a COVID-19 lead person. It might be yourself as manager, but give somebody the responsibility for managing it and for communicating to other people. As regards PPE, use your standard PPE like gardening gloves, helmets and so on in the ordinary way, and don't add more of that in an attempt to protect against COVID, because it won't actually be relevant or effective. And there will be some checklists added to this, which will tell you a little bit more about this. Thank you, Debbie. Now, who can return to site? Well, I've found that there's quite a lot of confusion around these terms. Even looking on the gov.uk sites, high risk, clinically vulnerable and extremely clinically vulnerable, these terms seem to get a little bit mixed, and I think they're perhaps changing as time goes on. So I would say on this, just keep looking on the site, find what the most up-to-date information is. And when you've got that straight in your mind, you can then use that as a starting point to decide who is safe to come back to your site. Thanks, Debbie. When we're talking about staff and volunteers, as I say, do talk to them, communicate to them. Most of us are on small sites, so we've kept up to date with our staff. We know them really well. But on some bigger sites, perhaps it's difficult to know exactly perhaps the home setting for staff and so on. And it's possible you might want to do a return to work interview. So that could be done remotely, and that could just put some people's mind at rest that they are actually safe and happy to return. It might be that some of your staff are older, and are they happy about coming back? You know, if they're perhaps over 65, particularly volunteers. We had quite a lot of older volunteers where I used to work, and they might not be happy about coming back. Now, the next few points: can people work from home? Can they redeploy to a role where they can work from home? They're probably not terribly relevant in care farms, unless you have perhaps an admin person who could work from home. We've got to enable people to keep 2 meters apart or 1.5 meters apart. So I think that quite often this is going to be about reducing the number of participants that you're going to have on site. Work out your staffing ratios based on the needs of your service users. And we'll have a look in a bit more detail at what some of those needs are in a minute. It's important as well to keep, as it says, refreshing your audit frequently. People's situations change, so it's really important that they communicate any changes to you in their home setting or in their own health. Thanks, Debbie. When we look at service users, people with one-to-one support, well, who provides that one-to-one support? If it's the care farm, are you prepared to offer that one-to-one support, bearing in mind the restrictions that we've got? It might be that people needing one-to-one support should bring their own support for the foreseeable future. So looking at service users, are they actually able to observe, to know what 2 meters looks like? It might be that you need to develop some sort of 2 meter long sticks that people can hold out in front of them to give them an idea of how far apart people could be, as long as they're not going to poke each other's eyes out with them. Similarly, are individuals able to observe infection control? If you think about people who have bad hay fever, they are actually an additional risk. So it will be important to check with the service user and their home situation. If they do have hay fever, it might be a consideration that they don't come in for a while. People on the Asperger's spectrum may struggle to deal with all these changes. So it's actually worth perhaps putting that into your risk assessments. And again, are they going to gain more by coming back, or are they going to really struggle with it and find it difficult? So again, it might be that some of those people would be better staying away for some time. It's a balance, isn't it? We need to look at the individuals who are isolated and who would gain most. And that's only something that you as a care farmer, knowing those people, can actually work out. Again, look at the environment. Do you need to, in your break rooms, do you need to put tapes on the floor? Do you need to rearrange tables and chairs like they've done in schools and pubs and so on? And then how do we adapt our practices? This is really Keely's again. She'll be telling you about perhaps adapting activities and tasks. You might decide that you can't open 5 days a week. So possibly, you know, Monday, Tuesday 1 week, Thursday, Friday the next, something like that. And that would give you then extra days for cleaning and disinfecting. It would be good to have extra carers if possible, because your staff are going to be really stretched, I think, dealing with not only the tasks, so people, livestock, equipment, and also then trying to get people to keep social distancing. So if you could get an extra pair of hands, I think it would be very, very beneficial. Thanks, Debbie. I don't propose to spend long on this one. I think we have all seen this or similar ones. I mean, just be aware of what the symptoms are. Okay, Debbie. What do we do if someone does display any of those symptoms? Well, I think the first thing is really beneficial to have a COVID-specific first aid grab bag, first aid kit, which should have gloves, a mask, aprons, and probably a visor as well. So if somebody's got symptoms, whoever is in charge can put all that stuff on, find it very quickly and pop it all on. So with staff, obviously, if they get some symptoms, they need to tell you immediately and go home. Avoid touching anything, wash your hands, cough or sneeze into the tissue, sneeze into your elbow. Preferably use a separate loo if possible, and obviously don't go home on public transport. With service users, very much the same issues, but bear in mind that some people are not always aware that they're ill, or they can't communicate it. So all staff need to be very alert and keep checking that people haven't got symptoms. One of the difficulties can often be getting people home. I mean, I can remember having some people who they just could not get into their place, their home, until the session ended, and then there would be carers who would be on to get them home. So again, very important to liaise with the home and find out exactly what the arrangements should be. Yes, again, government guidelines on education settings. There's a really good sections on school systems dealing with children who have any symptoms. Any confirmed cases, you must communicate as whatever the government guidelines are at the time. I've looked online and it's not terribly clear at the moment, but I think that clarity will come. If you do get a case, you don't have to close, but firstly, liaise with your commissioners, and secondly, obviously, a really good cleaning after people have left. Thank you, Debbie. So if somebody can't get home, what do we do? Isolate them if possible. So this is really, it's best outside. Again, a separate loo. Wear your PPE, wear your mask, your apron, and so on. If somebody's really ill, you'd obviously dial 999. And for the member of staff who's helped with anybody with symptoms, they don't need to go home. But I think if I was being kind to my member of staff, I'd say get home, get showered, wash your clothes. I wouldn't particularly want them, you know, feeling uncomfortable and waiting till home time. And then obviously the area where people have been must be very, very well cleaned. Okay, I think that's the end of my section, isn't it, Debbie?
It is, yes. Thank you, Noelle. That's absolutely fantastic. I think there was a lot of information in there, a lot to take in. I think that's really, really useful. As I said at the beginning, for those that weren't able to log on initially, we are recording this. All of these slides will be available. The whole webinar will be available from the Social Farms and Gardens website to be uploaded, so you can get hold of this. And the checklist that Noelle has been referring to is also on the Growing Care Farming pages of our website. So thank you very much for that. I would like now to hand over to Keely Elvin, who I introduced earlier on from Elm Tree Farm. She's now going to discuss what's needed to actually put into practice the things that Noelle's been highlighting, and how you actually make reopening a reality. So if I move that on, that's right. Is that right, Keely?
Yep, just got
Over
it.
to you.
Perfect. Okay, so I think first off, I mean, if you kind of think of all the things that Noelle's just talked about, it can be quite overwhelming to think, oh my gosh, how am I going to make all this happen? But having now been spending the last few weeks trying to do that on site, it is simpler than it seems. Ultimately, you're trying to reduce risk. Nobody's making any promises that you can guarantee that people won't be infected, but we're going to try our best to minimize those risks. So ultimately, that's about trying to maintain the social distancing and ensuring the infection control through hand washing. So everything that we've been trying to do on the farm, that's the sort of thing that we're trying to think about. As long as it kind of takes you back to the social distancing and the hand washing, keeping your hands clean, that's kind of try to not get too overwhelmed with the whole, you know, daunting task. So some of the things that we've kind of looked at is, you know, starting from the beginning of the day, thinking about when people are turning up. Do you want a whole group of people turning up at once, or would it be better to stagger groups? What we're actually doing at our farm is we're having different zones where different people turn up and go to different areas because we have the space to do that. Think about how people are going to be getting there. So obviously try and encourage people to not use public transport. Can they use a bike? Have you got somewhere to put that bike? Have you got enough parking spaces, or enough, could you open a field so that people aren't parking right next to each other? With equipment and transport, if you're using a shared work vehicle, some people do pick people up, then how are you going to do that and maintain that social distancing? So if you can see in the picture here, some of the things that we have are screens that you put in between front and back seats so that you can make sure that people are isolated in that way. Having antibacterial wipes in the vehicle so that you can kind of clean over the frequently touched areas whilst before and after you kind of using the vehicles. We'll go on into cleaning in a little bit more detail, but obviously trying to think about the things that you touch. I think that was probably one of the biggest eye-openers, is looking at how many things you touch frequently, and making sure that you're kind of giving those a good wipe over. So going back to really transport arrival and departure, thinking about signage so people are aware where they should be going, where they shouldn't be going, directing them to the right place. We've also decided to be doing temperature checks ourselves. So we have non-contact thermometers. So you can literally just aim them at somebody, take their temperature, and make sure that we know there isn't too much of a risk there as far as we're aware. As you've said, Noelle, some people aren't always aware of when they're not feeling well themselves or how to communicate that. So that's why we personally have decided to take that on. Activities, again, think about how you're going to run your sessions so that you minimize people having to come into too close contact with each other, and is there going to be any tools that are going to be used as a communal tool, and how do you stop that happening? What we've decided to do is to colour code our tools and wheelbarrows, and give people information to say, okay, today you'll use anything that's red, that's your tool, that's your wheelbarrow. And at the end of the day, part of our routine and included in our task sheets will be, and now we're going to all clean those down together. So we're making sure we're making that part of our daily activities. Side by side rather than face to face. So again, you're reducing the likelihood of cross-contamination. We've also put bubbles in place. So on our farm site, there's different projects, and each of those will create their own bubble. And so they'll be partnered up with the staff in that bubble, and they will have dedicated areas that they will work in. We've made the choice of hiring in some portaloos as well to make sure that they can, each of those bubble can have a separate toilet that they'll use. So throughout the day, again, if you have small communal areas and there are a number of people that would like to come back, considering how many people you can fit into the room at one time to maintain that social distancing. So as Noelle mentioned earlier, making markings on the floor to say, okay, well, this is a 2 metre square area. So if you're in that area, somebody else can't go into that area. Working out, using that method to work out the capacity for each room, and then thinking, okay, well, maybe one member of staff needs to come in and take their break with 2 or 3 service users at one time, and then you swap over so that you're reducing that social distancing issue. We've asked everybody to bring all their own food and refreshments. So trying to remind them to treat it like a day out and having a picnic. So there won't be any communal tea making or shared plates or anything like that, to try and really reduce that. And again, monitoring the site to ensure that all areas are kept clear. So again, you sort of thing you don't really think of, but corridors of obvious pinch points, tool sheds, obvious pinch points. How are you going to manage those to say, okay, we're only going to allow so many people in that area at one time? And again, we've put a lot of signage up to let people know how many people are allowed in each room and each area. Hand washing, clothes and footwear. So again, what I've really taken from this over the last few weeks is social distancing, trying to keep away from people, but hand wash, hand wash, hand wash. I think that it depends on where you are, whether you go for the antibac gel or the hand washing. Just be mindful that if you have a bowl of water, then if you're asking lots of people to use that bowl of water, that's actually a cross-contamination point. So you'd be better off having hand gel if you're in that kind of facility. Whereas if you have more toilets, you know, making sure that there's lots of soaps ready there for people to use. There's some evidence that the virus can stay on fabric, so making sure that everybody is wearing fresh clothes, keep changing your clothes as regularly as possible. We do have here a boot room where people can borrow boots and coats if they've forgotten theirs, but we've decided to stop that, asking people to bring everything in themselves, and we'll give them each a container so they can have just their things in there. The other thing that we need to consider as well, and we're preparing for, is that people will forget gloves, boots, lunches, and what will we do about that? So some kind of contingency plan that says, okay, we have a few bits and pieces. If somebody borrows it, that will have to be washed thoroughly before we can then hand it out again. So communication, obviously very clear. There are a number of easy read documents that are available. So if you can see, there's a link here to keep safe, and there are other free posters that you can download. Lots of it easy read as well. So plenty of signage to make it really obvious. So communication styles and forms can vary. So if you're working, as I do, with learning disabilities, we'll be using a lot more visual things, a lot more accessible ways of communicating. Other people may find that not needed, but to just make sure that you're giving everybody the information they need. It needs to be clear, concise and regular. Again, if you can send out task sheets with jobs that are already outlined with step-to-step guides, that's again gives your staff and the people that you are working with more information on what's expected of them to maintain social distancing and control infection control. With the staff and volunteers, again, we have chosen to keep up regular meetings. So we have twice a week meetings and regular updates from our head office on COVID and what we should be doing. We've also put together an easy read document, which we have shared on our website, on our Facebook page, and we'll be sending out to all of the people we support, giving them an idea of what we expect them to do, what might be different. As Noel's mentioned, there may be people that really struggle with change, and how are they going to cope with that change? So we've asked and kept up wellbeing calls with all the people we support throughout, to just let them know what we're doing to try and keep people safe, what we will be expecting them to do to make sure that they keep themselves and other people safe, and how things may change in the future. Again, if we've asked homes to make sure that they're reiterating that, so to make them aware that when you come back to the farm, things are going to be a bit different. You might not be able to spend time with the people you usually do. You might not be able to go to the places that you usually do. So as much information you can give beforehand, the better. Again, important to think about the mental health in times of uncertainty. I think that goes for everyone. The people that were supporting, the staff as well. Change is stressful, but when you have no idea of the ultimate outcome, that's even more so. So to definitely bear that in mind. So yeah, we have stuck to the 2 metre distancing. We felt that that was more appropriate and a clearer, more concise message to give. We went on the basis that if you say 2 metres, people will try 1 metre. So we've tried to kind of keep it to 2. Washing your hands regularly. So making sure you've looked around. Is there space to keep this 2 metre distancing? Is it practical? Is there enough hand wash points to us to keep doing that? When will I be doing that? So making it clear that we expect you to wash your hands after you touch your face. So all of those kind of things. And think about the activities that you're going to be doing. We have set up outdoor workstations. We have an outdoor covered area where people can wait if they're showing symptoms, where it's nice and open air but covered. I think, thinking about when people may be a bit concerned that they have symptoms, then if you can find somewhere for them to continue to work outside until they are collected, that's better. That kind of relieves the stress, but that's not always possible. It may be that you need to be inside. And how are you going to do that? How are you going to make sure that somebody feels relaxed still whilst they're waiting, but they aren't posing any other threats? Are the staff going to have to wait with them, and so on? We've also sent out in our information requesting that there is always somebody there to be on call. So as Noelle says, sometimes you have people who their support isn't at home throughout the day. So we've said we do need to make sure that there's somebody there who's able to collect people if they are showing symptoms. And yeah, made as many outdoor sheltered areas as we possibly can to make sure that people can work in a less restricted area. So yeah. Is that all of mine? No, one more. Site cleaning. So again, this is, we kind of scratched our heads a lot about this. We do have a cleaning provider. So we contacted them to talk about end of day cleaning. And we went with the idea that if you try and clean every frequently touched surfaces, you'd be there for weeks. So we actually just decided to have the biggest spring clean known, so that we're reducing the amount of things in the room that need cleaning. It's amazing when you look around, you think, wow, I touch a lot of things during the day. So we've just really kept it to a minimum. Banisters, handles, toilets. What we're trying to do is to make it part of the every working day, so we're involving the people we support in that cleaning routine too. All of what we're trying to implement, the social distancing and the cleaning and the hand washing, your verbal support, your reminders is what's going to be key throughout the day. So setting the example, constantly reminding people of what to do. We're trying to make sure that we're doing at least 2 cleans a day. And again, as Noelle said, if somebody has symptoms, what we're doing is not necessarily closing down that project, but we will be carrying out a thorough deep clean in between and then monitoring people from that point onwards. We have been advised by our head office that we should use disposable cloth where possible. We are putting any cleaning materials into a separate bin, which we'll then tie up, put into a separate bin again, and then not putting that into the general refuse for 72 hours. So we're double bagging and isolating that for 72 hours before it goes into our general refuse, just to make sure that we're not passing on any cross-contaminated materials into the bin system.
Fantastic. Thank you, Keely. There is something about people saying, reminding us not to touch our faces that always makes me want to touch my face. But thank you so much. That's a huge amount of information in there from both you and from Noelle. The information is on there. This all is supported by the checklist that we have available. Everybody who is on our circulation list should have received an email about that. It is up on the website. If there are any issues with you accessing it, please do let us know. But I'm sure that there are probably quite a lot of burning questions after that. I shall just move this on. We've now got Pearl and Sarah back available as well, and Noelle and Keely on hand for you to ask any questions. So I'll hand over to you, Sarah, because you've been monitoring the questions.
I have, yes, yeah, no problem. Yeah, we've had 2 or 3 questions have come through at varying points, so I'll just do them in order that I've received them through. So the first question was basically the section where you were talking about what would happen if someone showed symptoms on site, whether that be a staff or a service user. And the question was, would everyone in contact with that person then need to self-isolate for 7 days? It was really just confirmation of that.
So do you want me to take that one, Noelle? Well,
yes, please.
What we've been told by our head office, and again, there's always a lot of confusion. I must have been asked 100 different questions, which are similar to this, is that we have been told that they should be tested, and if they have confirmed COVID, then yes. If not, then it's just symptoms. So again, what you're then relying on is other people then going through and getting that test. So we're saying not. What we're saying is we will give it a deep clean. If you're in contact with a confirmed COVID case, then yes. If it's not confirmed, deep clean, advise them to stay home for 7 days.
That's what the educational guidance says as well. If that person who's sent home tests positive, then yeah, whoever's been in contact will have to go into isolation.
And again, if you are sending people home with symptoms, then that needs to be followed up with a phone call to say, we believe this person has symptoms. How will you then follow that up by providing that person with the facilities to get tested?
Okay, right. Okay, that's great. Thank you. The second question was actually for Keely. So there was a question from an attendee asking if your farm is actually open at the moment, or whether you're still in the preparation to reopen mode.
So we have one project which is already open, which is our supported employee project. We have opened on a reduced days, so we've reduced the amount of days that people are coming in to limit the amount of people that are in works vehicles and in the actual base at any one time. I think our aim is to, and again, this could change, I think our aim, along with the guidance around shielding ending on the 1st of August, we aim to be having everybody back on some form by that time. And then in line with schools, we're hoping to have everybody back at capacity by the beginning of September. What that means then, at the moment, we're not having to do so much of the staggered breaks where people work in kind of groups and stagger their breaks because everybody can fit in the room. When we're back to full capacity, what we're aware of is that we'll have to start doing that because indoor workspaces or even outdoor workspaces could get overcrowded. So it's about not just thinking about how you return now, it's thinking about what that means on phase 2 and phase 3.
Right, okay, that's great, thank you. The next question was, hi, I was wondering what materials you've used for building outdoor shelters, as mentioned by Keely, and whether there is a particular design.
No, I think that what I would say is don't buy a gazebo because they just blow away, literally. I can't tell you, I've bought some very, very heavy duty gazebos that after one decent wind has ended up in a pile of fabric and metal. So I wouldn't advise that. We have gone for sails that you can tie up. We've gone for heavier duty parasols with heavy bases that you can pop up and put down again, which means that they're not left out to the elements of, and particularly wind overnight. So look at what resources you have. So we found a group of trees where we could tie a sail to. We've looked at areas which we haven't necessarily used as outdoor working areas that actually fitted perfectly. So look at your site, look at what you can do to try and do so. Again, it depends on what resources you have there. Each farm will be different, but what we've I would strongly advise not a gazebo, but look at how you can maybe use parasols and sails.
I think you can get there's some really good event shelters in camping stores and camping websites, and they're quite robust, aren't they, in terms of wind and weather?
Yeah, and again, at the moment, I think that one of the issues for us is that the weather's kind of fine-ish now. What happens in the winter? How will that change? And that's a bit of an unforeseen for us at the moment, really. So again, it's trying to think, okay, a parasol in a sail may be okay now, but what are we going to do come November when the weather starts to really turn? How are we going to facilitate it at that point?
Okay. Right. So really, it's just down to what resources you have, basically, and what's going to work best for you. The next question. Sorry,
I was just going to mention that there is. I think you guys have shared on the Grow and Care Farming website or Facebook that there's grants available as well for people to buy resources that might help them. So that's worth looking at for anything that they're going to purchase.
Yes, there's quite a lot available, lots that are national and also lots that are very much regional. So normally the Growing Care Farming newsletters will have links in there that people can follow to look at perhaps local funding opportunities, like you said, to buy additional resources to help them meet the requirements of reopening. The next question is around trustees. What to do if your trustees are being overly cautious and do not want to open until August, even though other gardens are starting to open? What would be your advice, Noelle?
Well, it depends on the relationship you have with your trustees and who they are. I mean, they basically they are the people in charge. So I suppose unless you can persuade them that you're ready to go back, they really have the last word. I don't know what you think about that, Keely. It depends. You're in quite a big organisation, aren't you?
Yeah, I mean, I would say ultimately what they're concerned about is risk. So I would go back to your risk assessment, and a risk assessment, I always think of a risk assessment to be a little bit like the Three Little Piggies, is the likelihood of that being blown over and the severity of it if it is blown over, so if you kind of go back to that and say, okay, well, this is the risk, this is what we're going to put in place to reduce that risk, and then present them with a really robust risk assessment, maybe that will alleviate some of their fears.
I think I don't know if any of our attendees took part in the webinar around around insurance risks, which was with McLaren's and through the main social farms and gardens kind of webinar that they ran, which was very much, if the concerns are around liability, then really, as long as you can prove that you have risk assessed and that you've done everything reasonably possible to mitigate those risks, then ultimately it's unlikely that there would be any legal implications for any organisation if someone did contract COVID-19 or any other sort of easily transmittable illness. So I think it's about reassuring them that you've been through the process that we're recommending, that you've looked at all those mitigations and you got them in place, and as long as you can, then there isn't really much more you can do. I mean, as you said earlier, Keely, you can't guarantee that no one, staff or volunteers or service users, isn't to catch it while they're there, but you've done the very best you can. So I think it's about just trying to communicate that to the trustees and perhaps even get someone from the insurance company to give you a bit of information about, to assure the trustees that they're happy if you've done those steps. Sorry, I better move on because we've got about 10 minutes left, I think. So the next question is from someone who is on a school farm and they provide overalls as part of their PPE for students. Are they allowed to share overalls, or do they have to be provided with individual overalls?
I think that they should have individual overalls. They shouldn't be sharing. Or, you know, if day by day, if a different group uses, say, you know, you start with a group on Monday, and then Tuesday's group would be expected to use them, then they've got to be washed and dried in between. I don't think you can compromise on this one at all.
Okay.
And
no,
I think
I agree.
with washing as well, if you're responsible for handing out the overalls for people to use, you wouldn't necessarily rely on that user who is returning to wash them. You would consider washing them yourselves to make sure that you know,
if you have facilities to
yeah, exactly.
Yeah.
So no sharing.
Okay, so hopefully that's answered that. Another question is, if you are socially distancing on site, then will everyone still need to self-isolate when someone's tests positive? I think we've actually
covered that, really,
covered that already. So if it's just to recap, if it's someone goes home with symptoms, if it's not a confirmed case, it's just a case of cleaning everything down thoroughly. If you follow up and find that they have tested positive, then there's a potential 7-day isolation period for everyone who was in contact with that person whilst they were on site.
Yeah.
Okay. Right, another question is, if the guidance changes from droplet to airborne, will this change everything? Is there any advice on folks who wouldn't wear masks?
When it says folks who wouldn't wear masks, does it mean who were expecting to wear masks?
I'm not sure, because I think in the full guidance document that we've produced, I think we've said that people can't, especially service users, you can't force people to wear masks, can you? I think that the government slant is, if anyone wants to wear a mask, then you have to support them in that. But you can't force people to wear masks. So I'm not quite sure. Perhaps the person who sent that question in could perhaps send another question just to clarify exactly what they mean by that, because I'm not quite sure.
So I can tell you what we've kind of decided to do, because again, we're aware that of the government guidelines, but the organisation I work for is a health and social care provider who works in houses as well. So what we've been told is that they would expect the staff to wear masks if we're indoors working with people we support or within 2 meters of them. We've also been sent information with, which I think is downloadable from the government website, which is little cards which you can print out that says I have a learning disability, or I'm autistic, or I have a disability, and therefore I'm excluded from wearing a face mask. So we've got some of those printed out, especially for people that have to travel on public transport, for example, or and again, with that coming into place for people going into shops, that might be relevant. So again, if you choose that the government guidelines might say that it isn't compulsory, but if you choose to, that's okay too. So we've made the choice that we will be wearing face masks whilst we're working in 2 meters or in an indoor setting. But we wouldn't expect our service users to.
Right, okay, yes, the clarification did come through, and the gentleman was talking about people with autism particularly. So obviously it you know, the government guidance suggests that, as you've said, that they are not obliged to wear them for that reason.
And we will make them available for everybody, and we will encourage everybody to, but again, I don't think that you could insist.
Okay, right. And the only other, it's not really a question, it's more of a sort of asking for particular hints and tips, was where potentially to look for sales if you were going to look at buying a sale. Perhaps can you remember where you sourced yours from, Keely? And we could maybe.
It was
It was little, right? Okay. Yeah. Okay.
Opportunist purchase, but again,
I mean,
Amazon.
Amazon, garden centres, lots of places are selling this type of stuff because it is the time of year that people want to be outside and setting things up. But yes, that I've certainly looked online for them personally and have found them on Amazon and things, so I'm sure they're readily available. It's just making sure that you double check the dimensions of the space you've got.
Yes, totally.
Before you order, because they're probably not the easiest things to kind of repackage and send back, really.
No, definitely. And make sure that you do secure them really well, because what you don't want to create is another risk by not having well secured cells. So yeah.
Yes, it could, if it whipped off at one corner and hit somebody in the, that would not be ideal, would it? No. I think that's all of the questions covered, unless we just give another minute in case anyone else feels that there's anything burning that they haven't answered already.
Is the sales question related? I can see one here about hand washing. Where can we get the hand washing things?
Now earlier, sorry, that was a question earlier, and that person, sorry, I did reply to that without copying everyone in, because I wasn't sure if it was a question that everyone could see. In terms of, I wasn't sure whether that meant the actual hand washing supplies. One thing I did post just in the chat function is a resource that I'm aware of, which is it's a plastic sink. They're designed for going in the back of work vehicles. My husband has one in his work vehicle, and it's actually got a thermal reservoir in the top. So on a morning, you boil the kettle, or you fill it with hot water, whatever. Obviously not boiling water, but you fill it with hot water, and it stores that and keeps it warm. And it has a flip down front panel that creates a sink underneath and a tap, so you can actually wash your hands under warm running water. The water goes into a reservoir, so you're not asking people to put their hands in water that has already been washed by someone else, and therefore it's a really good and fairly safe way. Now I put a link in the chat to these portable sink units, and they're not cheap. I think that particular link was around about 160, 170 pounds. However, if you're working outdoors with people and you want to be able to guarantee hot water and people not cross-contaminating, it is a good option, with obviously with some soap. So I did post that in the chat if anyone was interested, and I think it's just called I can't remember now. If you follow the link, can you see them?
Van Gadget.
Handyman insulated portable sink unit. And as I say, you often find that utility vehicles have them in the back, because there is obviously a legal obligation to provide hand washing facilities to people who work outdoors.
Sounds
great.
Good.
Well, I've learned something new. I didn't know anything about those, so hopefully that's been helpful to those who've attended. So I think it looks to me, as Sarah says, that we've had all the questions for now. If anybody does have any sort of further questions, please do get in touch, obviously. But for now, I guess it's really just up to us to sort of say thank you so much for joining us. Thank you particularly to Keely and Noelle for your time and your expertise. I think it's been really useful. I think it's a subject which is going to be sort of ongoing, and it may be something that we need to sort of possibly do a sort of follow-up on going into the winter as people have reopened, and looking at perhaps some of the implications in poor weather. You've all made the point today that obviously it will look very different in November compared to doing these things in sort of July. So it may well be something that we follow up on. We hope that everybody who's attended has found it useful. You're going to receive an automated email a few hours after this webinar is finished with a link to a short feedback survey. Please do complete it. It does help us to keep track of who's accessing the resources, and it also provides opportunities for us to sort of learn and adapt our work moving forward, and allows you to suggest other subjects and things that you might find useful. The webinar recording will be uploaded onto our website shortly, and we will make sure that we send a notification around when that's happened. But in the meantime, please feel free to contact any of the Growing Care Farming team for any further information or support. And don't forget to follow us on Twitter and tag us into any social media posts that you have. The links are there. So thank you very much, and we look forward to having you join us again at a later date for other webinars. Thank you and goodbye.
Thank you.
Bye. Thank you.
Bye.